Welcome to Coronavirus in Texas, a virtual event series from the Texas Tribune. While the Tribune has paused our in-person live events, we are moving the conversation online with an ongoing series of virtual interviews. Before we get started, we want to thank our sponsors for supporting today's conversation, AT&T and Texas 2036. We also want to thank KXAN for their media support. Though donors and corporate sponsors underwrite our events, they play no role in determining the content, panelists, or line of questioning. Thank you for tuning in.
Good morning. I'm Evan Smith, the CEO of the Texas Tribune, and I want to thank you all for tuning in to today's virtual conversation with Congressman Chip Roy, Republican of Austin. We will be talking today for about 45 minutes. In addition to my questions, I'll be asking the Congressman a few submitted by our readers. Congressman Roy was elected to represent District 21 in 2018 and is running for re-election this November when he'll face a Democratic challenger, former State Senator Wendy Davis. In the 116th Congress, Congressman Roy sits on the Oversight and Reform, Budget, and Veterans Affairs Committees. Previously, he served as First Assistant Attorney General of Texas under the current occupant of the job, Ken Paxton, and Chief of Staff to U.S. Senator Ted Cruz. A native of Bethesda, Maryland, he has undergraduate and master's degrees from the University of Virginia and a law degree from the University of Texas. Congressman, good morning. Thanks so much for joining us.
Morning, Evan. How are you?
Good, thank you. Congressman, you saw Governor Abbott's announcement yesterday that we are one step closer to reopening Texas. Hair salons, nail salons, tattoo parlors, pools. You're all for this.
Well, I believe it's important for the people of Texas and for our nation for us to re-engage as a society. I think I've been very public about that. As you know, last Friday when the governor announced, he just announced previously that we were going to at least start the process, phase one of reopening restaurants. I thought it was really important for us to get out and get engaged. And I think the Statesman was there and Jonathan Tylab wrote a piece about it. But I went with my family to One in a Million and went and had some breakfast in East Austin and have been to a few places since then. And I think it's really important that we get out and show that we can safely and appropriately engage because people are hurting. 30 million unemployed across the nation, obviously a significant number in Texas, Central Texas. We've had 30,000 unemployment insurance claims as of last week. We'll get a bigger number tomorrow. And so it's really important for us to open up and we can do it safely and wisely. And I think the governor's right to head in that direction. And look, one last point on that. You know, we've seen what's happened here with Shelley Luther in Dallas. There's other examples across the state of Texas. I talk to them every day. I mean, Evan, I've spent my time talking to people in the district who are hurting, barbershops, hair salons, restaurants.
I want to, Congressman, I want to come to Shelley Luther in a second. The news on that today I want to ask you about, but more broadly on this question of reopening Texas. Are you not worried that this is going to increase the spread of the coronavirus? Or are you resigned to the fact that some people are going to get sick, some people are going to die, right? We've heard Chris Christie, the former governor of New Jersey, yesterday echo comments of others in Texas who said, look, basically, we've got to accept the fact that some people are going to get sick, some people are going to die. We don't want that, but we just have to face reality, and reopening Texas trumps either of those things.
I think that framing misses it a little bit, with all due respect. It might be critical, but I think that's been part of the framing that has been causing people a little bit more of a concern about it, as opposed to, look, what we're talking about here is what is the healthiest, best way for us to move forward. I'm concerned about the negative second and third order health outcomes of a shutdown economy where you can't go see your doctor for, say, cancer screenings. I'm concerned about the negative second order health outcomes of people suffering from mental health and opioid addiction who aren't going to get treatment or care, or who, by the way, we now know, or we look at data that shows that you have a twice as likely chance of committing suicide in a situation where you're unemployed, right? When things stack up around you. 30 million unemployed. I mean, we can talk about the economy in a minute very separately, but 30 million unemployed. Put all of that into pot. And the goal here is for the least amount of human harm, right? And so the virus is one piece of a much larger puzzle. So should we reopen our society? I believe yes. I think it is important for us to engage as human beings together, to worship together, to work together. Can we do it in a way that protects the most vulnerable, the elderly, the people who are immunocompromised? As you know, I'm a cancer survivor. I had to go through a spell where I had to make sure I was paying attention to how I was being exposed. And so it's important that we do that, and we can do that. And so I don't accept that as a sort of that sort of like a choice, right? Well, it's really harsh. I mean, it's also interesting. Bill Maher, of all people, right? I mean, I don't often agree with Bill Maher, although he tends to be a little, has some libertarian streaks. He went on a rant the other night. You may have seen it, where he was explaining, guys, for for millennia, we've been fighting microbes. We've been fighting bacteria. You put your head down on a pillow, you grab a doorknob.
Right.
We need, and this is the last point, this is important. We need immune systems that are strong. We need immune systems that can fight this. We need herd immunity. So we have to work through this together to get re-engaged so we can build that up.
The point is simply that we believe that if we reopen the state, that there are going to be some people who, because we're all back together, are going to get sick. And I'm just making sure that you appreciate the fact that is a choice. For all the reasons you've said, you're also accepting the fact that in all likelihood, given the way this disease is transmitted, that more people are going to get sick. If that's okay, that's okay. But let's just say so.
Okay, but let's put the proper framing in it. Okay, so Governor Abbott is being criticized because he said in a private call a few days back that it is ipso facto correct that some more people will get exposed and some more people may get sick. Right. I do not disagree with the analysis on its face that is a true statement, but here's the problem. Here's the I guess positive. We need to be able to engage to do that for an overall net positive outcome, right? In other words, we need to have society interacting together as safely and positively as possible to make sure it's happening. By the way, if we take the right steps to target nursing homes, where in many jurisdictions, 30 to 40 to 50% of the entire cases that have resulted in death or serious situations have come out of nursing homes. So we need to focus on the elderly. My dad is 77 years old. My mom is 71. That's how you address this.
Congressman, on the Shelley Luther case, which you just mentioned, speaking of the governor, Shelley Luther, the Dallas salon owner, famously now made a decision to keep her business open in violation, in defiance of both county and state orders. It was not just Dallas County Judge Clay Jenkins, whose order she was in defiance of. It was also the governor's order, backed by the Attorney General's office, by the office of your former boss, Ken Paxton, saying this. So yesterday, Ms. Luther was sentenced to 7 days in jail and was ordered to pay a fine of $500 per day that she remained open. It's about $7,000. You said yesterday on Twitter, you tweeted that you had spoken to her. You thought that the situation was terrible. You've said this a number of times. You believe that no American and no Texan should face this. Did she not violate the order of not just the county officials, but also Governor Abbott?
She certainly was disregarding those orders. And I think that that's something that obviously, as someone who worked in law enforcement as a federal prosecutor in the Attorney General's office, I obviously have a strong concern about, the rule of law. But here's
rule of law matters, Congressman, right? Rule of law matters.
The rule of law matters. It matters at the border, by the way. It matters in our streets. It matters for everybody that you follow law enforcement. And here's the thing that's really important. Go watch everything that Ms. Luther has done. She's been respectful at every turn. She has treated law enforcement respectfully. She has followed their direction on how she goes to handle her engagement with law enforcement. She was respectful of the judge. She disagrees. She is acting civilly disobedient in the face of something she thinks is wrong and that she would argue is arguably unconstitutional or unlawful. Now, I haven't studied every intricacy of the order that was given. I haven't had time to do that. But on its face, and I've been reached out to by a lot of people, the fact that a woman wanted to engage in a way in order to protect her family and take care of herself. Meanwhile, by the way, she hasn't been able to get a PPP program loan. I'm asking, by the way, the judges in Dallas, whether anybody in Dallas is willing to step up and say, you know what, we'll pay you for your losses. We'll compensate you for being shut down. We'll compensate everybody else. Or are they going to come to Washington and say, you know what, we need you to borrow another $1 trillion so that we can pay for local governments to keep people shut down? This is the woman who wanted to feed her family. She wanted to feed her family.
These are legitimate issues to discuss. I'm simply asking whether she did defy the governor's order. And here again, there was a letter from the Attorney General's office, Ken Paxton, no liberal, last week. In a letter, his office said, the governor's order is neither vague nor unenforceable. Local governments are prohibited from allowing businesses to reopen. She is in violation of the order. I heard you on the Mark Levin show a couple of weeks ago compare people who support stay-at-home orders to Nazi Germany. Were you talking about local officials, or were you talking about Governor Abbott and Attorney General Paxton?
Evan, hold on. That is completely. Now, look, you and I go way back. That's untrue. What you just said is completely not true. Now, hold on.
What did you say?
Evan, I'm not going to do this. We're sitting there in person. That's how we'll have this conversation. Let's slow down for a minute. Give me a minute to respond, because that is untrue. What I said, and that, you're repeating the talking points of my political opponent in the DCCC right now. Let me be perfectly.
To the Mark Levin show.
Let me be perfectly clear. Yeah, go run the tape. Go run the tape. If you go back and look at what I said in that interview, what I was talking about was a Maine sheriff who I believe was responding to and pushing back on the Maine governor for not stay-at-home orders, but because they were enforcing people being able to be out on the highway in order to go something and just doing stopping people to check them, as opposed to being able to go through and say, hey, we're going to have a common sense response like the local law enforcement that I've seen here in Texas, the Hays County Sheriff, for example, who basically said the same thing, said, hey, I'm not going to go around stopping people on the street. And my point was that when you have government stepping in police state kind of format where you're stepping on civil liberties, which you and everybody else that I know, particularly our great state of Texas, across the political spectrum, should be concerned about civil liberties. You've got people getting stopped for no reason. So now go back to your question. Is she disregarding or disobeying an order? Yes. And she's dealing with that right now. My point is we shouldn't be coming down with a 7-day jail, no bail sentence for her wanting to keep her barbershop or a hair salon. Sorry, I'm a guy, although I haven't been to the barbershop in a long time. Hair salon open because she's wanting to take care of her family. As she said in court yesterday, I want to feed my kids. She told the judge that.
Right. Will you call on her to be pardoned, as some others have done since she was sentenced yesterday?
You know, I haven't done that because I haven't looked at how the pardon statute, if it's such a, how the pardon system works in the state of Texas. I don't know. And as you know, because I used to work in the Attorney General's office and prosecutor, I hate to always tell people what they ought to do without going and looking at the statute myself. I do believe that steps should be taken, state or local, to make sure this woman's not spending time in jail. And look, I believe that across the board, by the way, and in situations where people have this kind of a situation where the government is stepping down, not just this woman, but others.
Okay. Congressman, so the theory of the case here is that we can reopen Texas because we trust people to be responsible, or we need to trust people to take measures in their own lives and their own communities that will allow us to endure whatever is coming once we reopen the state, right? Yeah. That's the theory of the case here. Right. Is your cursory view of how people have behaved in the midst of this give you confidence that that's going to be the case? We have seen photographs of people at Barton Springs or in Zilker Park in Austin or in other communities around the state where people don't really seem to be observing social distancing, don't seem to be respecting the basic courtesies that would be extended to them, hopefully, in a situation in which we can all get through this together. What is your
Look,
how the public is responding?
My observation is, and I've been out and about a lot in the district, trying to be I've met with the sheriffs of most of the counties I represent. I've met with hospital administrators. I've gone to help with the food bank 3 or 4 times, San Antonio, Fredericksburg, Hays County. Really, and by the way, the food bank's doing a phenomenal job. A little side note about what they're trying to do to help people. They really are doing an extraordinary job. Right. But my observation has been mostly, there's always the hiccups, mostly people very much following. I mean, you walk into Home Depot, whether it's in Hays County where I've been or in South Austin on Brody Lane, most people are wearing masks. Most people are socially distancing. You're sitting there in front of the bolt drawer or the plumbing's aisle, and I've been there a few times during this, and you're pulling out a drawer and someone kind of comes up and says, excuse me. They don't walk right up, and they kind of keep a wide berth. I've been on airplanes flying to D.C. where we had 17 people on one flight, 40 on another. People spaced out across the plane. People wore masks. If they were separated enough, they might lift the mask and kind of sitting there sleeping. Right. People are, for the most part, because they're rational, self-interested human beings, they're taking steps to try to protect themselves and their loved ones. And, I said to Jonathan Tylove in the Statesman last Friday that I wouldn't go to 1 in a million with my 10-year-old, 9-year-old son and daughter, my wife, if I thought that was going to endanger them in a meaningful way. I also noted, kind of like Governor Abbott said, I noted that was I at a higher risk of getting the virus there than at my house? Yeah, technically, probably so. But there's no way I can dodge the virus fully. I can't live indefinitely dodging the virus.
Right.
So I didn't know if I got sick last week. I wouldn't know whether I
Right.
got it at 1 in a million or whether I got it on the airplane a week before,
On the
or whether I
airplane,
got
on
it
the
at Home
airplane
Depot
to
or
DC.
HEB.
Yeah. Congressman, you've called out the fact that you have seen people wearing masks in various places. We solicited questions from readers this week, and overwhelmingly the question we received more than any other is, why won't Congressman Roy wear a mask? You were famously one of the Republican members who, when on the floor of the House, were called back to vote. You did not wear a mask. That was reported accurately, right?
Sure. Yeah, no, that's correct.
Have you been wearing a mask around your district as you travel out? When you're out with your family, do you wear a mask?
Depends on where I am. I've worn masks in certain settings and haven't worn masks in other settings. When I was on the floor of the House of Representatives, it was a mix, probably 50-50. I don't know, something like that, depending on who was on the floor at a certain time, right? Because people came on and off.
Well, the reporting, Congressman, was that the 50 that had masks on were Democrats and the 50 that didn't have masks on were Republicans. I'm sure that's not exactly right.
I'm not sure if that's exactly accurate when I looked across the floor,
Yeah.
but what I did saw was that Speaker Pelosi was fairly notably on the floor when she was speaking, not wearing a mask. I had my mask with me. I was wearing a mask on the airplane. I wore a mask at times if I were in the Capitol, like say you're going on an elevator, although I didn't. I walked upstairs. But, if you're walking around, if you were in tight quarters, I got to a place where there was a lot of people, put my mask on. I think it's important for the American people to be able to see your face. And so when I spoke on the floor of the House and was down there, I didn't wear a mask around the district, to answer your question. When I've gone
Is it best practices, Congressman? Is it best practices? I mean, I looked up, I'm conscious of the fact, we've talked about this many times, that you're a cancer survivor, as you called out. I looked on the MD Anderson website today, and this is the first thing that popped up. Cancer patients should always wear a face mask or face mask anywhere they go, or a fabric mask anywhere they go. Are you concerned for your own health, let alone anybody else's health? Well,
Lord willing, I'm 9 years removed from my diagnosis this July, knock on wood. I understand myself to be, from an immune system standpoint, consistent with the standard population for the most part. So I don't view myself in a special situation as anybody else 9 years removed. What I remember at the time is I didn't wear masks at the time when I was sick. My doctor and we all had the conversations, and we didn't think that was something that was necessary. We took care in terms of where we would be. I was able to deal with an elastic shot to boost your immune system, but you had to be careful. And we observed. You might remember I was on the Rick Perry campaign, and so the day after my treatments, I wouldn't go to the office. I would work at home and then take a day to sort of boost my system back up, and then I'd go back down briefly. So now
the point is, you don't feel like today that you necessarily have to wear a mask all the time because you're a cancer survivor, and you don't think that that's necessarily required by either public policy or public health.
No, but what I would say is for example, one of my staff's mothers just finished treatment and has got through cancer therapy, so she's staying removed, and I would wear a mask were I her. My dad, who's 77 and a polio survivor, I encourage them, and my mom, to wear masks, and they've been largely removed. I tend to believe that it's a mix. We've seen some downsides. A guy got in a wreck because he was wearing an N95 mask and deprived himself of some oxygen while driving his car. We ought to just use common sense and judgment here.
Right.
For the most part, that's what people do. And by the way, different restaurants and different businesses can change their rules. So I went into one place, Graceland Barbecue, going out 290. If you go out there, they require a mask when you go in. Another place down the street doesn't. People will adapt to this.
And that's how it should be. You think that's how it should be? People should
Absolutely.
make their own.
You vote with your feet and you decide how you're going to work on that. People can make decisions.
So the question, Congressman, of the confidence that you have in our ability to come back, to open the state back up, and that the public health environment will hold. Do you think Texas is doing enough testing? I believe, as I've looked it up in the last 24 hours, that we are still, even with an increase in testing, at or near the bottom of all states in per capita testing. Are we doing enough? And if we're not doing enough, why is that?
Well, if you take testing on a national level, right, we've had somewhere in the zip code of 7 million tests that have been administered in the United States, which is a pretty extraordinary number. When we had tested about a week or so ago, about 5.1 million, that number was greater than the total of Australia, Austria, Canada, India, about 15 industrialized countries combined.
But I'm talking about Texas specifically, Congressman.
No, I'll get there. Texas, of course, has had a significant number of testing, and the uptick is now growing quite a bit. But part of the issue is Texas has been spared, I think, both by just our geography and the situation, but also by some of our choices. But we haven't had the kind of situation that New York, New Jersey, and others have. So more of the tests that have been available have been going in that direction. But we're now getting to the place, and I don't have the most recent numbers from yesterday from what the governor talked about yesterday. You might. But they're moving and trending up in a very significant way in terms of the numbers of tests that are available. I've talked to local healthcare providers in the district, some of the more regional hospitals, New Braunfels, Kerrville, and they've got in-house testing. I know New Braunfels. I know they're working on that in Kerrville. I can't remember if they've got it or not. We've got a significant amount of uptick in the ability to access the test. But here's the other thing: people have I think a misperception on what some of the testing ability can do for us. For example, some of the serology testing and like the Abbott and the antibody testing that people are talking about. The San Antonio health expert down there, when I was on the phone with her last Saturday with the rest of the Texas delegation, she said, we're not advising using those at all. We're not going to use those because they're unreliable. There are different perspectives on what those kind of tests can do for us. In fact, my old cancer doctor said, wait a second. You could have an antibody from 6 months ago, from 2 weeks ago. Yeah. Is it really helpful to know that? If you get tested today, or do you need to get tested
you think,
tomorrow?
Congressman, you think testing is not the point? People who are focusing on whether we're doing enough tests, that really is not an indication of whether we're ready to reopen.
It's a part of the overall puzzle. We want more testing. Again, 7 million tests is a lot of tests. We're continuing to ramp them out. We had 200,000 tests a day. Remember on March, whatever, it took us until March 20th before we even got to 100,000 tests.
But that's 7 million nationally. There were 29 million people in Texas alone, as you know.
Yeah, I get it. But not everybody needs to take a test. Again, look at the data. If you look at the data for people aged 0 to 65, I mean, kids for the most part have been, God, thank you, Lord, have been spared, right? For the most part. And 18 to 65-year-olds, the risk profile is very, very consistent with other illnesses and viruses we deal with. Clearly, the lion's share of this horror of what they're dealing with in New York and New Jersey and other parts of the country, right here in Texas too, the elderly are the ones. It's just absolutely devastating what has occurred in our nursing homes and in the places where we've got congregated elderly. And by the way, that raises questions about the merits of a complete lockdown. A lot of the studies that are showing being out and about, very little indication any studies have shown that anybody has shown a demonstrated case of catching it outdoors. Yet everyone runs around saying, shut down the parks, shut down the beaches. Like,
okay, so Congressman, if nursing homes is the issue, you know, the Tribune and ProPublica have been reporting on the fact that we don't have adequate transparency on the incidence of the coronavirus in nursing homes around the state. Families of people who live in nursing homes have been asking for more data. The press has been asking for more data from the state. And we don't feel like we have an adequate picture of exactly what the pervasiveness of the coronavirus in nursing homes in Texas is. Should we have complete transparency on that data if, as you say, that is the real focus or should be the real focus?
Well, I certainly think we ought to have access and understanding of that data. I'm certain that the governor and the people in the office of the governor want to have that or have that. I don't know the nature of the exact level of transparency, but I'm happy to ask, Evan. I mean, I agree with you, and I've seen a few of y'all's stories on that point, and we've been digging around daily on all the different facts to try to understand stuff. So I'll be happy to reach out to the governor's office and try to find out more about the state of things in the nursing homes. I know I had my staff look carefully at Texas 21. They're continuing to try to dive into and say, hey, are we taking the right precautions? I know that the governor's directives on this or guidelines and what they're trying to put out, that we're trying to follow the best practices and go even further than whatever the CDC guidelines and stuff to ensure that the folks that are in nursing homes in Texas and particularly Central Texas are safe. But happy to ask and look into that.
So speaking of Texas Tribune stories, since we're turning this into an ad for the Texas Tribune, let me ask you about a column that Ross Ramsey wrote earlier this week about the debate over blanket immunity for businesses. I'm sure you're familiar with this. There's a discussion in Congress about whether when we reopen parts of the country, whether we should be providing businesses with immunity so that if employees on the one hand or customers on the other hand decide that they want to sue businesses over contracting the virus or any other issues that come up, that businesses would be protected. Here is Ross's question posed in his column that I'm going to pose to you. If it is safe to reopen, as you've said it is, why do we need blanket immunity? And if it's not safe, don't the employees and consumers of your district, District 21, deserve legal protections? That was Ross's point. Let me ask that question of you.
Well, of course they deserve legal protections. Our legal system provides legal protections. And I think the question here is one of, look, I remember, and you remember, the very blatant abuse of the B-readers and the lawyers that were, frankly, going where they shouldn't go in terms of going after companies on asbestos in such a way that people were getting dollars who weren't sick. That's well recorded, right? There were people that were getting money, and then the people who were sick were being left out. What we don't want to do, with all due respect to some of my former law school classmates who are trial lawyers, what we don't want to do is overjuice the ability of trial lawyers to be able to go in and say, hey, you opened your doors, you're guilty, that was negligent. It shouldn't be negligence to say, I'm opening my doors for business. It would be negligence to, for example, let's go back to something that we know something about, E. coli. If you don't clean your stuff properly and you end up, somebody gets E. coli, well, that's negligence. You didn't take the steps necessary. You should be sued. So what is it here with respect to the coronavirus? Well, I think we need to build that out a little bit. We can have protections, for example, for simply opening your doors. It shouldn't just be, I open my doors, I'm negligent. But, what would be the appropriate steps to take place? You see restaurants that have people wearing gloves when they hand stuff out, or their wait staff are wearing masks. What's going to be the standard for this virus? And I think a little bit of give and take is going to have to occur on this. But the question on the table, and for Ross, would be that you can have protections in place that are reasonable, because what the trial lawyers will try to exploit is by just sheer opening in the face of this, you're negligent, and that would be wrong. And we need
you will support congressional action to provide immunity to businesses.
Remember, I'll want to wear my federalism hat here and say that this ought to be mostly up to the state of Texas. I don't love, in fact, I was having a bit of a debate with some friends in the White House the other day about this. I know the itchy finger to say, oh, let's come up with a national solution. Look, I want our national economy to get reengaged. You know that. I've been very public about it.
Right.
But I don't want to forsake the principles that I think are part of what make our country great to allow Texas to be able to decide this. We ought to have a robust debate about it.
Right.
We Texans decide what goes on in our local Texas courts, not Washington. So I think we need to have that debate here for the most part.
Has Congress done a good job on this, Congressman? I mean, I'm sort of asking you a question that I think I know how you're going to answer, because you've been pretty public in saying that you thought Congress has not acted in a couple of different ways the way that it should, beginning with the fact that on March 14th, you were one of the 40 or so members who voted against the relief package, believing that it was not handled in the right way. As you think about the economy and what's happened since March 14th, does that feel like a good vote to you? Would you like to have that vote back, or do you still feel like that was the right decision to make?
Definitively the right decision to make. And in fact, that's borne out, and the data has shown that. If you go back and just for clarification for listeners, there have been now, I think, 4 votes, right, on different packages.
Yes, sir.
Well, let me reframe that. We haven't voted. There have been 4 packages. The first one had a vote. It was $8.3 billion with a B. I voted for that to sort of gear up for the government being able to handle the crisis. The second one was the one you allude to. We didn't get the text till midnight. It had a provision in it that, for well-intended purposes, was designed to try to ensure people could get sick leave. But my point was, you can't take sick leave from a job that doesn't exist. Small businesses were calling me regularly saying, guys, I can't keep people on the payroll with this mandate in place because I can't afford it. So I went down and said, guys, we need to change this. We had no amendment, no ability to change it. I was stuck. So I said, no, I'm voting no. I would do that tomorrow, Evan. I'd vote no.
And you would do it. And you would do it again.
Oh, yeah, absolutely. I mean, not even a close debate in my mind on that one, because it's been hammering small businesses. They've been letting people off 100%. People have been getting laid off because of that provision, in addition to others. Third bill was the $2 trillion bill. Never got a chance to vote on it. That was the one where my friend from Kentucky, Thomas Massey, kind of pointed out we should have a roll call vote. We didn't. So it was a voice vote. It was a voice vote, right? Yeah. Yeah. I did put in the record that I would have voted for that bill, because I think the constituents of Central Texas, have a right to know how I would vote. So I said I would vote. Only 100 members did that. But I think you should know that. I had serious reservations. The bill included a provision that has unemployment insurance at $600 a week, paying people more not to work than to work in some cases. So now I have 53,000 employees in the Texas 21 for 2,300 restaurants who are getting hammered because so many people are being laid off. And now the restaurants are having a tough time hiring people back because of the unemployment insurance provisions, which means the restaurants can't get the loan forgiveness that the very bill that we passed at the time was designed to fix. These are the
but
kinds
you
of things
but you voted for it. Yeah, but you thought on balance there was more in the bill that was good than bad.
Well, I'm not even sure I would say that. The reason I said I thought I should support it is because so many businesses were getting hammered that the $350 billion and the other money in there to try to keep these businesses afloat were really important. And then I voted for, as you know, I actually had a roll call vote 12 days ago, for the bill. It was $470 billion, $300 billion of which was additional money for loans for small businesses and hopefully some forgivable loans for those businesses to try to stay afloat. I've been on the phone, last point on that, I've been on the phone nonstop with hotel owners, restaurant owners, I'm not going to name different restaurants, but prominent restaurants in Austin, Texas and San Antonio, Texas and throughout who have shut down and laid people off and are dying, right? They're trying to save their businesses. We've already lost Red Gills. We've already lost Magnolia Cafe. We're trying to hold on to these gems and that employ people because otherwise we won't have any place to put people to go back to work. We got to save these restaurants and these small businesses.
One of the criticisms, Congressman, from some quarters has been that the federal government is not providing enough relief to states and local governments, the way that they have been hit economically, and that you all in Congress should be acting more on behalf of state and local governments in terms of providing relief. Politico reported this morning that Texas is among the states asking the feds for advances totaling $6.4 billion in May, June, and July to cover the cost of an unemployment payout at the state level. California and New York are also among those states. Leader McConnell has said on the Senate side, maybe we ought to let states go into bankruptcy or take the bankruptcy option. What do you think Texas should do? Should Texas be left on the hook or should Texas get additional relief from the federal government?
Well, first of all, we've allocated close to $3 trillion in different ways, shapes, or forms. We need a complete audit of that to know where these dollars are going. We need to review it top to bottom. That's why we ought to be meeting. We ought to be having oversight, number one. Number two, we have allocated of that money expressly, although there are additional pieces to it through unemployment and so forth, but expressly to state and local governments, $161 billion. Keep in mind, in a given year, state and local governments raise about $1.6 trillion in tax revenue. This is about 10% of that total haul. We've already written a check. We've already done. So we need to know how that's being spent. We need to know what states are doing with it. And the third piece to this is what I think Leader McConnell is alluding to, and I've said this, is we don't want to reward bad behavior in two respects. One, states that haven't been fiscally responsible. Texas shouldn't be bearing the brunt of keeping them afloat. And so we should be mindful of that. Texas itself, we got to be mindful of. The second piece to that is the moral hazard of relying on, and I alluded to this when I was talking about the hair salon in Dallas, the moral hazard of the federal government funding state and local leaders making decisions about keeping people shut down. Because if we have the state and local leaders keeping people shut down, the economy can't get restarted, the tax revenues don't flow, then they need more backstop funding and the economy doesn't have it. We don't have the dollars in Washington. We're borrowing more money. I'm on the budget committee. $3.7 trillion is this year's projected deficits, $2.5 trillion next year. That's an extraordinary number. And we've now reached the tipping point for the first time since World War II, where we have as much debt as we do GDP. We've got would you oppose
the request by Texas to get that $6.4 billion in advances to help with the unemployment payout? Is that something that you think, because of what you just said, the states should not be getting additional relief from the federal government?
Well, what I said was we need to review every dollar that's been spent. But I'm going to put it this way. I'm not going to be advocating for an additional dollar out the door until we review all of the money that's been spent.
That's already been allocated.
How it's going to be done. And I want to know whether states are opening up so that we can get economy going to pay for all of this. And by the way, I'm trying to give voice to the people that I listen to every single day, every small business throughout this district, every hospital person I talk to, everybody I sit down and say, the overwhelming perspective has been, guys, safely and securely, we have to have dollars flowing in our economy because we're going to lose our livelihoods. They're hanging on by a thread, y'all. I mean, 30 million. Put that into perspective. We have already lost in 6 weeks 8 million more jobs than were gained from 09 to 19 under both Obama and Trump. We're not looking yet at the numbers for this week. I mean, Evan, if I can make one point,
these are going to be really bad numbers this week, are they not? They're going to be bad.
I'm worried that they're going to be very bad numbers. And if I can make one point on a totally nonpartisan basis, and I really mean this, whatever happens in November happens in November, whatever happens going forward, we have got to get going together in a way to preserve this great republic in this state and our communities. People rely on these jobs for their livelihoods. We cannot print money as our way out of this. There is a safe way for us to engage. I'm not trying to lean into this in some way that's foolhardy. You don't think for a minute that I worry about my 77-year-old dad or worry about me or worry about my family bringing home a virus. Of course I do. But dadgummit, 30 million unemployed and the businesses that I'm watching crumble, people who call me in tears because they let somebody off of work, trying to give voice to those people, that we do our job on a bipartisan basis to figure this out. And look, I'm optimistic that we can bounce, but man, it's like a freight train. If the freight train comes to a stop, starting that freight train is really hard. We've got to keep that freight train moving and then accelerate through this in a way where we can do it. So we can't wait 2 years for a vaccine and survive economically and through our health system.
Right. So I appreciate you saying something about, I don't care what happens to me. You understand that there is an election coming up in November. Obviously, we're talking about stuff that's very critical that's happening right now. But I do want to look ahead, if you don't mind, in the last part that we have together to this November election cycle, because there is going to be an election in November. There's going to be an election for president. There's going to be an election for members of Congress, including your district, District 21. There has been a discussion around increasing access to mail ballots, mail-in voting, absentee balloting. For people who are concerned about the public health environment. We saw what happened in Wisconsin a couple of weeks ago, where there was a big fight over whether people would be told they could access mail-in balloting or whether they had to go vote in public. Why don't we want more people to vote? Why are we asking people to choose between voting in person and their health? That is one way that this has been framed. What do you think we should do here?
Well, the critically important piece to this is that we want as many Americans as will vote as possible, right? We want everybody to have a stake in the system. We want people to show up and vote. The issue here is whether or not you want to flip our system on its head and to convert to all or significant mail voting, or some people propose online voting. There are all different proposals out there. And the concern, of course, is election integrity and making sure that we know that votes are being cast by the person that says they're casting the vote, and that we eliminate and make fraud something that is not undermining our republic, undermining our democratic republic. And so I think it's critically important that we do that. And by the way, if you look at Wisconsin, I've yet to see a spike or anything that anybody has said was statistically significant related to the fact that they had voting. And so
in fact, the Wisconsin Congressman, excuse me. Yeah, in fact, the Wisconsin Health Department said that 36 people at least are believed to have gotten the virus as a consequence of voting in person. There has been reporting on this.
Yeah, right. But there's no. I've looked at that report and looked at those studies, and I've not seen any significant study that has shown a spike as a result of their election. And by the way, that was in the heat of the initial outbreak a few weeks ago. And what we're talking about is laying out a system where we can have this work, and we've got till November to do it. I think we can have a system where, when we did our hearings in D.C., we came in, we had a process by which we stayed 6 feet apart. We came in, we did our thing, we voted, we ballot. And to guarantee the integrity of the election system in ways that we have done it historically. I'm a believer, and I always have been, about let election day be a day where it's a holiday, or you give people the ability to get off. We have early voting. You've got time to be able to do that and go through the process of doing it and taking time to do it. You've been in the lines at Costco or Home Depot, or the things where they got the things winding around, or you've got arrows putting people through it, where people can safely go through a process to be able to do it.
Your position is that we should not expand mail-in voting because of the concerns you have expressed about integrity of these elections.
I think that is the better path forward for us, is to create a system on election day and an early voting that allows us to do it safely. I think that's the better
Congressman, approach. Have you seen the database of online database of election fraud cases by the Heritage Foundation, which, as you know, is a conservative think tank, used to be headed for a while by Jim DeMint, which says that there have only been 1,300 documented cases of vote fraud of all forms over the last 20 years across the country. Only 143 of the instances of fraudulent use of mail ballots have resulted in criminal convictions. Really, only by my count in their database, only 35 allegations of mail fraud over the last 20 years, according to the Heritage Foundation in Texas. It doesn't seem like that many, right? I mean, if the Wisconsin Health Department is to be believed, there are more people who got the virus on primary day in Wisconsin than have been accused of mail fraud in Texas for the last 20 years.
Yeah, but keep in mind, look at the numbers and tell me what's the percentage of votes cast during that time by mail?
By mail.
Yeah,
well, I can tell you what happened. So I can tell you about one state. So in Oregon, which has started mail balloting to all voters since 2000, there have been 50 million ballots cast in Oregon, and there have been only 2 fraud cases verifiable enough to result in convictions for mail ballot fraud in 20 years in Oregon, with 50 million ballots cast. That's Oregon, right? Mm-hmm. One example. I mean, I'm just asking whether we want to really pose the choice here, and whether, since we all want more people to vote, wouldn't we be better off giving as many people access to the ballot as possible, even if in a public health emergency, it means expanding mail ballot.
Well, Evan, look, you know what? I'll be happy to look at the Oregon data because that's interesting. I hadn't seen that data about the percentage on Oregon. I'm happy to look at that. I know that I've seen reports and studies, we're looking at oversight, that does still raise concerns about what happens on mail-in ballots. And when you escalate the numbers to 200 million, or as opposed to the small fraction that historically has done mail-in voting, right? We have historically gone on election day and voted at the booth and pulled the lever or pushed the button or whatever the system is you use. And so changing that system on a dime increases the odds of potential fraud, right? When you're making changes, you know, when we've gone in, you go on election day and it's a changed system. Sometimes it's clunky, even when we're doing that, like changing everything, particularly. Yeah. And it's also, by the way, it's obviously a state and local decision on that. But look, I'm happy to do whatever is going to maintain election integrity and be able to do what's important to make sure that people have access to the ballot box.
People have access. Everything is a choice. Yeah.
I tend to believe again, I think this is one of those fights that becomes seemingly partisan or political, that to me is just one of look at the data, oversee it, and then decide the best way to have the right election system set up. I tend to be I'm a conservative by nature, to kind of stick with what brung you and create the system that will work safely to do that. I think we can do that. And again, you're confident that by November,
the public health ecosystem will be back enough that people can have confidence in going to vote in person.
I believe so. I mean, again, I have confidence today on May, whatever today is, 6th or whatever.
So you would vote in person. You'd vote in person today.
Yeah, no question. With literal no question. And elderly or people that can, request ballots at home and do so under our current laws, by the way. Yeah. And I think they could do that and be able to sequester themselves. Those that, wanted to go through the line and vote could do so in an independent form, in an early voting frame. But again, we can look at ways to make that system better. I just would be a little concerned about kind of turning everything on its head and saying like everything's suddenly mail-in ballot and so forth. But look, let's be clear. Let's be clear about the general point. We want as much access as possible to the most Americans possible to be able to get access to vote. And we want it to be safe and secure, and we want it to have the integrity that it should have. I have seen studies of concerns about the potential of fraud when you open it up to the level of 200 million ballots across the country, et cetera. Plus,
I'll tweet out the link to the Heritage Foundation's data, right? And people can debate. So I want to quickly get to 2 audience questions here. First, Mary Beth writes in and says the CARES Act gave tax breaks to big companies. As a fiscal conservative, how do you propose ruling out tax cuts to people who don't deserve them, irresponsible tax cuts? Do you accept the premise of the question, first of all?
Well, Mary Beth, I appreciate the question actually very much. Not knowing at all what your political ideology is, it could go either way, because I share your belief that we need to make sure that we're not picking winners and losers, and particularly that we're not picking winners and losers in such a way that big businesses get benefits out of this. One of my primary concerns right now is, with all due respect to the president, we hear people talking about, the stock market's hanging in there and doing great. Well, yeah, because Amazon stock is up and other big companies that are doing well, that can kind of take advantage of this environment, yet small businesses on Main Street are getting crippled. So one of the problems with the PPP loan program was that it has so many restrictions and rules in it that it, one, made it harder to get the loans for the small guys, the community banks. Big banks came in and had a lot of the loans. 2, it created an environment where it was hard for these guys to go out and get the loans because of what I already described, the rules that were in place with respect to unemployment. So there were a lot of things that were barriers to the little guys. What we want to do is, I think we can go, and I've said this to some of my colleagues, is figure out on the back end via tax policy, potentially, how can we make sure that nobody's getting some sort of windfall by being able to go out and get this? Like somewhat infamously, people talked about Shake Shack and talked about Ruth's Chris. Through some amount of pressure, they gave it back. Harvard, which of course isn't a big company, but it's a big entity.
Right.
We got these entities.
Monty Bennett, the fellow in Dallas who had all the hotels, right? Just decided to give that money back.
Yeah. And there are others. And I think that's working out to some degree. I know some who have not gotten headlines who have chosen to return it. And look, the same thing, by the way, with the $1,200 checks. You had people who are independently wealthy, but who had a low income a certain year, or lower, who got a $1,200 check. That's not a perfect system. But let me say one last thing. That was a $2 trillion bill. $350 billion went out in the PPP program. To put that in perspective, the Small Business Administration only on an annual basis puts out $30 billion. So it was a quick program, so there are going to be mistakes. To fix it, to answer your question, we can, on the back end, I think, find ways to make sure through tax policy nobody gets a windfall, and some of us are talking about those sorts of things.
Let me ask you, we're sort of out of time, but I've been given permission to ask you one more question, if that's okay.
Yeah,
I'd like to do that on behalf of our readers.
I can go as long
Thank
as you
you.
guys
Well,
want to go.
It's dangerous for you to say that, but let's see what happens here. Brian writes with a good question that I was actually going to ask a version of myself, but let me put it in his words. With tens of millions of people losing medical coverage when they lose their jobs, right? The connection of your health insurance to your employment. Should the healthcare system be overhauled to move to universal healthcare for everybody? This is a subject that you and I have talked about many times. Your brand, Congressman, has been repealing the Affordable Care Act, right? And replacing it with something else. So is this a moment when you really system, and what would we be moving to if we need to reform it now, based on what you see?
I got 90% of what you said. You broke up. I don't know if it was my end or your end, but I got it. I got it.
Go ahead.
Which is, and let me address the question that was asked. The first part of the question: do I think we need to overhaul our healthcare system? Absolutely, and I've been unequivocal in my belief that we need to do that, because I believe we need to maximize the ability of you to be able to control your healthcare without having to go to either an insurance bureaucrat or a government bureaucrat to tell you how you're going to get your healthcare. We need to expand direct primary care. You need to have dollars in a health savings account, or the ability for you to be able to take money that's given to you from your employer, whether it's maybe government, Medicaid, or Medicare, or whether it's your direct earnings that you put into an account in a tax-free basis to be able to go get the doctor of your choice. Right now, a lot of those DPC doctors are actually one of the few places some people can go immediately to go get health care in this sort of topsy-turvy environment, where we've got hospital corporations who have been laying off people and furloughing people in light of the various orders about how elective surgeries can be done, when those elective surgeries are the things that fund the big corporate hospitals. We need to get that out of the way. We need to bring back the black bag doctors and the ability for you to be able to go get the care of your choice. So overhaul our system, absolutely. What I don't want to do is flip and go empower government bureaucrats a little more than insurance bureaucrats or anything else. Right now, my belief is our system is flawed because it's a highly regulated environment where health insurance companies are deciding your health care. That's not good. You should decide your health.
So the conversation, Congressman, doesn't change in view of the coronavirus. Your view of how we should overhaul healthcare pre-coronavirus will be your view post-coronavirus.
Sure, because it's based on the principles that I believe. But I'll tell you this, I think the coronavirus has highlighted our need to do what I've been advocating to do, which is create that kind of healthcare freedom so you have control of your healthcare. You have the dollars in your pocket to be able to go get care and choose the doctor of your choice, not have to listen to some kid on a phone in Omaha, Nebraska tell you that your doctor's out of network and that your deductible is $10,000 and you're wondering what the hell you're going to do for healthcare. That's wrong. We got to fix that.
So last point on this. The Associated Press reported this weekend that if we had eliminated the Affordable Care Act by now, coronavirus would have been among the pre-existing conditions that would have given an insurer license to deny. About pre-existing conditions in a world in which we upturn the current system and move to something that you're talking about going forward, because there are a lot of people who have anxiety about well, if we don't have what we have currently in place, what protections will we have should another situation like the pandemic happen? What do we do about that?
Well, sure, and I don't know what the exact report you're saying about whether something would or would not be a pre-existing condition. I don't like it when
read out the AP story again,
okay.
along with the Heritage Foundation.
No, please do. I'm happy to look at
that.
that. I don't like it when insurance companies or government play games with what is your contractual right to be cared for, right? And by the way, side note, we're seeing a little of that right now with some of the business interruption insurance, right? About some of the companies that are kind of pulling back, and the insurance companies say, whoa, you businesses coming in saying this is business interruption. And I think we need to be looking at that as well to make sure insurance companies are honoring that. But in the healthcare front, look, my answer to this has been for a long time. The pre-existing condition issue boils down to two things. One, price. You've got to be able to afford healthcare. In other words, no matter what we do, whatever we do with respect to the rules on pre-existing condition, if prices keep skyrocketing like they have been, then it kind of doesn't matter, right? It's so expensive, it becomes difficult to get care. So if government's providing it, well, so what? It's going to get rationed, and we're not going to have the dollars to do it because it's so expensive. So price is one thing. The second thing is access to the care that you need to get because of your health status. So if you've got a pre-existing condition and you don't have coverage, that's a problem. So you want to eliminate that problem by making you have your care and your coverage that you possess not tied to your job. The coronavirus is highlighting the real problem with having it to where your ability to get health care is tied to your employer. It's fine for your employer to provide a benefit, but you shouldn't be trapped. We don't do that with automobile insurance. We don't do it with homeowners insurance.
Right.
We've created a system that's created the pre-existing condition issue by virtue of its very structure. Turn the structure on its head. You blow up that by reducing prices and making it to where you control your care, and you're not left in a position of being pre-existing. In the event you fall through the crack because you were sick, lost your ability to pay for coverage or whatever, you can have an environment. And Ovik Roy, my friend in Austin, writes a lot about this. I've talked about this quite a bit, about having a pre-existing condition pool, right? A guaranteed coverage pool. There are ways to do that so that if you fall through the cracks, you can have a backstop so you're taken care of. But for the most part, we can make it to where people have no issue whatsoever. You got to fix it on the front end. You can't come in on the back end and fix it.
All right, Congressman, we have gone over our time, but I really appreciate your being game here and your willingness to answer these questions and to participate in our event today. Thank you so much for being here. Let me thank everybody else for tuning in and to join us today. And thank you to the sponsors of today's event. If you keep up with the latest coronavirus news in Texas, subscribe to the Texas Tribune's evening newsletter for updates at trib.it/coronavirus. On behalf of everybody at the Texas Tribune, I'm Evan Smith. Congressman, thanks very much. Thanks, everybody. See you soon.
Evan, thank you. Thanks, everybody.
Thank you. Bye-bye.